Hello, everyone, and welcome to episode 32 of CCA's Medical Minute Podcast, sponsored by Kroger Health. And speaking of Kroger Health, we have today with us is Bridget Wojciak, who is their Director of Nutrition. Welcome.
Hi, Steve. Thanks for having me. I'm excited to be here.
Good. We're glad to have you. Also happy to have my colleague, Sherry Hughes, aboard today. Welcome, Sherry.
Always good to be here. And you know what? I guess I'm going to kick things off first with Bridget. Hi, Bridget. So good to have you with us.
Sherry likes to get right into it.
I like to get right into it.
I'm ready. Let's do it.
Kroger Health is a part of the very large arm of Kroger, of course, and it covers everything from vaccinations to telehealth, but so much more. So tell us about all that you guys do.
Well, that's the exciting part. I think when you think of a grocery store, you think, oh, here's my weekly trip. I'm going to go pick up everything I need to stock my kitchen, make my meals. You can also come there for healthcare, and that's one of the things that we're most proud of. In Kroger Health, we have over 22,000 associates. We actually have over 2,200 pharmacies, and we have over 220 convenience care clinics. So we're really robust when it comes to a healthcare perspective and allowing people to combine our power as a grocery store with our power as a healthcare entity, because we really feel like the two are really closely combined.
Mm-hmm. Yeah. And this is just a curiosity thing. I think I know, but for example, the health clinics, is there typically like a nurse practitioner there or something? Is there somebody that has advanced training, basically, that's running those?
Yes.
Okay.
Every little clinic location is inside a Kroger, and every little clinic location is staffed with a nurse practitioner, in addition to sometimes we have nurses, licensed practical nurses, as well as patient care technicians, to make sure that when you come into one of those clinics, you're getting top-tier clinical care from those practitioners. And the best part about it is it's so easy and convenient that you can pick up some groceries that you need, make sure you get your health squared away. The goal is to make being healthy feel very simple.
Mm-hmm. Okay. Yeah, that's cool. So as you know, we had your colleague Taylor Newman on last month, and so one of the things we talked about. Now, what's kind of funny about this is at the time it wasn't quite the burning issue that it is now, the cost of groceries. But one of the things we talked about was the concept that eating healthy is expensive. And so one thing she pointed out, and I thought I'd give you a chance to comment on a little bit more today, is she's like, it doesn't always have to be, organic, fresh produce. It can be, there are canned options, there are frozen options that are healthy. You kind of agree with that?
Oh, absolutely. Yeah. I would double down on that any day to say it does not have to be expensive to eat healthy. It might feel like that. And we all know when it comes to eating healthy, it can kind of feel intimidating, but I encourage people to think of the ways that it can be simpler. For example, we know lots of people are trying to get in more produce, which is awesome. 9 out of 10 adults are not getting enough produce. So if you make it a little simpler,
I'm on.
You know what? Sometimes
we got to work on that.
Sometimes I am one too. I am not a perfect person. I'm a registered dietitian by trade. Turns out I'm also a human being.
Yeah.
So we know that everybody's trying to make it easier to get produce. What if you could get items that are canned or frozen? And I'll give a perfect example. So let's say you're trying to get more produce and you're like, all right, I got to have carrots. Great. A fresh carrot is awesome. If you like baby carrots, that's awesome. What if you are somebody who travels a lot and you're worried about food waste? I think canned carrots can be a really good option if you pick a no added salt version, or if you're somebody who is into frozen things and you want to put them in a skillet and do them that way. I also just think it's great to make sure that you're trying items in a new way. So if you think of a spiralized carrot, makes it exciting. So there's lots of different ways to eat healthy. It doesn't have to be exactly thinking of fresh produce items all the time. Those are wonderful, but there are a lot more options.
Spiralized being like when people make the zoodles out of zucchini and stuff like that. It's okay. Gotcha.
Do you see how zoodles has become a very popular known? That brings my dietitian heart
kids,
joy.
Right?
It's a trick me.
Yeah. Well, in my own health journey with cancer, of course, I tried my best to focus on healthy eating, and I still do. But I know that there are so many resources that Kroger Health has to help patients that are going through, and just people in general with their health and healthy eating. So tell us about some of the resources that you guys have in place.
One of the things I am most proud to talk about when it comes to Kroger Health and the services that we offer is our telenutrition program. Yeah. We actually offer the ability to work with a registered dietitian via two-way video chat across the country. So at the start of the pandemic, we implemented this service because we knew our shoppers were concerned with eating healthier and also trying to stay home a little bit more often to make sure they were staying safe. And what we found when we implemented this service was a 300% increase in utilization in the first year because people found it so easy to work with a dietitian via two-way video chat. And the cool part about it is if you're intimidated at learning how to shop online or not sure what to pick, they can help walk you through that in addition to giving you information. I think the thing I like to emphasize is the advice is totally personalized. If you think, well, what about me? I'm at a specific spot in my cancer care journey. How will I make sure I'm getting exactly what I need? The dietitian is uniquely trained to address, I am very busy, I work a busy job, I perhaps have a spouse who has limited time as well, I have children who are picky eaters, I'm working through a diagnosis, maybe somebody else in my family has a separate diagnosis. The dietitian is trained to handle all of that and make it feel simple.
Well, before Steve jumps in, let me ask this question. Is there a cost for that service? And if someone wants it, how do they initiate?
So today, our telenutrition visits are $80 for a 1-hour initial appointment and $40 for a 30-minute follow-up. Within the next few months, we'll be able to accept insurance, which we're very excited about.
That's excellent.
Oh, that's cool.
Yeah.
Yes, we are pumped.
Is there any chance to record those types of things? I mean, like, let's say, for example, if you had a consultation and wanted to play it back, is there a way to do that?
For HIPAA purposes, we don't record appointments, and so that's how we let everybody know that everything is nice and secure. But the good news is your dietitian can provide you with resources at the end of that appointment, so you don't have to worry about remembering everything. They'll give it to you so you have it.
Yeah.
And we also encourage people, if you want to take the appointment with someone else in your family, let's say you might be the person going through a cancer care journey, but maybe you're not the one who does all the cooking and shopping in the household. Bring that person with you.
Yep.
I think that's excellent service, really, because
I agree.
that's
I
something
agree.
that you really need to focus on when you're going through that. It's just being as healthy as you possibly can. So, and I know once the insurances kick in, you guys are going to get a lot more people.
Yeah. And HIPAA applies. This is something I've learned since I've been here. HIPAA applies because you guys bill insurance companies. If you did not, you would not be subject to HIPAA. Did you know? I did not know, but I learned. So anyway, there's that. And I think that's really, I mean, I wanted to just kind of touch on that one more time because I think there's this concept. I mean, you think about the fact that how large Kroger is. It's hard to really get your head around the fact that there can literally be a personalized service for one of the largest retailers in the world to offer. And so, I mean, I think it's just a great idea. And I wonder if you guys struggle with what we sometimes struggle with, like if we get too much good word out about what we do, like how are we going to get all this done? So I don't know whether, do you guys talk about that much? I mean, I know we've learned it from Taylor, but is there much external advertising or anything around that?
We do. You'll notice some information about telenutrition available in the pharmacies. You'll see some commercials. You might see some in-store signage. But one of the most popular ways that we get information out and one of the most popular ways that people learn about us is actually word of mouth. We find that once people come to these appointments, they develop this tremendous amount of loyalty to the dietitian that they work with. Because if you think about the information that affects how you eat, especially how you eat in a cancer care journey, it's a lot of personal detail. Foods you like, foods you don't like, how your family chooses to eat and prepare meals. So once people get to know their dietitian, they're hooked. They want to come back because they love the idea that they have somebody to help them make it so simple to eat healthy.
Okay. Yeah. This is just something that just popped in my mind, so forgive me. But as far as like if you kind of think about one of the wellness clinics is a destination for you where you can actually maintain your health and make it simple, is there any type of reminder service or anything, or do people kind of have to pull that down from you guys, or do you push it out to people?
We pride ourselves on making it easy to be healthy. So when you sign up for a telenutrition visit, you will get reminders.
Okay.
And the cool part is it will give you a calendar invite too.
Okay.
And I'm that person. Even today I said, can I have a calendar invite?
you did. That's right.
Can you go in, if you're just walking into the Kroger store and, you go over to the pharmacy, can you go in and inquire about it that way?
You can. Our clinics and our pharmacies are able to help you sign up for a telenutrition appointment, which I think is a really awesome opportunity to highlight how the care at Kroger is holistic.
Yeah.
You can see a nurse practitioner for your healthcare needs. You can see a pharmacist to help you understand everything about your medication regimen. And both those practitioners are able to connect you with a dietitian. So it really is kind of a one-stop shop. And we also work with primary care physicians and communicating the information out back to your other members of your care team, even outside of Kroger.
It's incredible. I mean, really what you guys have been able to do, but there's one thing you still haven't figured out, which is how to get people to put their carts away in the corrals so they don't run into the side of my car door. And the rare occasion I actually go to the grocery, by the way. So I know one thing, Sherry. Did you want to talk? I know you wanted to talk about the Wellness Festival.
Yeah, that's coming up. And I know it's usually a very large event. Lots of people go to it, and they get a lot of this information there as well. But what do you have in store this year for the big wellness event there? It's a festival, and of course, lots of information, lots of people.
The simple answer is everything. Everything is in store. Our wellness festival is, I'm tempted to say a dream come true. It is workout classes, cooking classes, lots of free giveaways of healthier food, information from experts. We have all our registered dietitians on site at our Kroger Health booth. You can connect with lots of healthier brands and learn about new products. It's also just a great way to meet and mingle with other people in the community. I think my favorite part is probably the panels. So they'll bring in all sorts of celebrities and healthcare experts, and they have them chat with each other in a panel format. And it's a bit like this, and you get to hear the inside scoop on what these experts really know and share with the communities. It's the best.
And it's probably a great place to get signed up for, like dietitian services and your resources, because I'm sure you have a lot of folks there on hand to talk more about nutrition.
We do. And the cool part about that is you get to meet these registered dietitians face-to-face in person. So the service, telenutrition, is provided via video chat, but I promise they are real human beings with real hobbies who are funny and interesting, and they're easy to talk to. And that is a way that you can meet them at the Wellness Festival to see it for yourself.
I heard you guys going to have some smoothies and a lot of fun little food snacks and things like that
Sounds
that people
good.
can take back at home.
If you are a foodie, this is the place for you. I can say that through experience. There are so many amazing, delicious foods to try, and the cool part is they're nourishing foods.
Skyline.
There you go.
There was a chili cook-off last
There
year,
you go.
There's a
There
chili
you go.
cook-off.
and Rodney McMullen made carrot chili.
Really?
I tried it myself. I was a judge. It was delicious.
Okay.
Interesting. I haven't dropped the bomb yet on Chris that I talked to Jane last week about maybe recording a live podcast down there.
Uh-oh.
So anyway,
So we'll be
We're
there
ready.
I'll
recording?
tell him now,
Yeah,
and
we're
he
ready
can't
to
really
do it.
resist or say much in defense. But anyway, so yeah, we're really excited about that too, and thank you, by the way, for the invitation to participate. So I think we'll figure out how we're gonna do that, but we're really excited about the opportunity.
The date for that, the wellness?
Oh yeah, that's right.
It's in September.
Okay.
Yeah, September 23rd and 24th is what we heard. So
Very good.
And there's like, did I hear this right? That there's hundreds of thousands of people that attend that over the course of the weekend?
Yes, it is enormous.
Okay. That's incredible.
So the lines for the free food?
Yeah.
That's
true.
the good part is there are so many different places to get free food.
Yeah, I know. That's all you have to say.
I
Free
wouldn't want to be
food and
stuck in
people
that.
will be
I
there.
would not want to be
That's
stuck in that carrot chili line, but by any means.
I would. Sign me up.
That's right. Well, not Taylor. For Bridget, thanks for being with us today. Really appreciate it. It was nice having Taylor out last month, and we'll look forward to having someone from Kroger Health each month to talk about things like this, because they really do. Some of the things we talk about, cancer treatments and things, they touch some people, but not everybody. This really touches everybody. So it's really important stuff. So everybody join us next week. Our guest will be Dr. Robin Zahn, and she is she's a practicing medical oncologist. She's a former board member, American Society of Clinical Oncology, and is a recent recipient of their Distinguished Achievement Award. And so she'll be in. We're going to talk about some of the really exciting developments that have taken place in cancer treatment over the last couple of years and what she sees coming in the future. So that'll be another great episode. Thanks, everybody, for joining us. Thanks again, Bridget, and we'll see you next week at noon.